empowering you.
Hello, once again, it is the Masked Students Guild, and we are still running the birth control and reproductive health campaign. We are in our last week, counting just days to put it to an end, but hopefully it will be productive. And everyone out there, I know that you are learning something every day, and today I am humbled, I am happy, I'm delighted to host Dr. Derek. Dr. Derek, you're highly welcome.
Thank you so much, Miss Bridget.
Okay. Oh, so Derek, who is Dr. Derek? I know you are a fifth year medical student at MAST, but people out there would like to know more about you. So who is Derek?
So my name is Tibamanya Derek. I'm a 5th year medical student at Mara University of Science and Technology. I am so delighted to be on this platform and to also have a small word to share with us in line with reproductive health. I'm so delighted that I'm honored by Miss Bridget. Thank you so much.
Oh, thank you so much. I am also humbled to host you, and I know that we are going to share something that is going to help the girl child out there and the boy child out there. We are in a campus setting whereby we should be having knowledge about our own health. We should explore more about our own health because we are grown up. We are grown-ups, and I know this is the right time for us to know more and more and more about reproductive health. So doctor, what do I have to know about reproductive health?
So in line with reproductive health, because it encompasses a lot of things. One, including our people that are in a reproductive age, and that involves both the ladies and the gents. So understanding the reproductive health, as we hear the word, there is reproductive and then health. It means reproduction at any point. It means reproducing, all having copies, all that continuity in humanity. But then when it comes to health, it is a state of well-being mentally, social, and then as well as psychologically. When someone is in an upright sense, we qualify the person to be healthy. So combining the two words reproductive health, it brings about how someone can be reproductively fine without any problems in line with our reproduction.
Okay.
Yes.
Thank you so much. There are some challenges that come with reproductive health, and I would like to know, what are those challenges? What are those risks that come with reproductive health?
So there are so many things. This includes gender-based violence. It includes infections. It includes infertility and many more. But every time something leads to the other, it is sort of a cascade. Okay. Yes, one thing has always led to the other.
Okay.
Yes.
All right. There has been silence on reproductive health challenges, and as you've already mentioned, the different challenges, but then still we do not always take a step even when we know these challenges. How can we break the silence on these different reproductive health risks?
So one of the things we need to continuously sensitize the masses. One, someone needs to understand their rights. And whenever anything happens in line with reproductive health, there has to be consenting. In that, none of the parties is injured, all is put at risk. So breaking silence is one of the main goals. Sensitization as well is also very important, and as well as understanding where to attend in case of any complication when someone needs anything related to medical services when they are suffering any sort of reproductive health issues.
Okay.
Yes.
Part of the reproductive health risks, one of the challenges that many people have been facing are STIs and UTIs, but this actually, it hasn't been addressed in some communities because it is one of the things that hasn't been addressed in some of the communities. Some people don't differentiate what are STIs or what are UTIs, and they are suffering the same problem now and again. What is the difference between UTI and STI?
Now, understanding STIs and UTIs, very many people confuse the two terms, but let me first try to start it from an STI and an STD. We commonly use STI for STDs as well. One comes before the other. For example, an STI, these are sexually transmitted infections. It means that you have to first get an infection or to get infected by, let's say, a bacterial microorganism, or it can be a viral, or it can be a parasitic kind of microbe. Then from there, when that microbe is introduced in one's body, that's when now this person is going to start presenting with symptoms, and then we shall call it a disease, that someone has gotten a sexually transmitted disease. For example, there are very many kinds. There is something called bacterial vaginosis. Now this is called it is caused by Trichomonas. It is a microorganism. There is also syphilis, that is caused by a microorganism called Treponema pallidum. So when all these are introduced in one's body, then they start presenting with what we call a disease, and we shall say someone has syphilis or someone has gonorrhea. You understand? But you cannot say someone has let's say Treponema pallidum. No, that is what causes the problem.
Okay.
So after the infection is into someone's body, they are going to present with symptoms, and then we shall say someone has syphilis. And then on the other hand, talking about UTIs, it's a broad term, because most of the STIs or STDs, they also they get introduced into our systems similarly in the same manner. UTIs, in broad term, they are called urinary tract infections. So talking of urinary tract infections, there are so many risk factors, and one of them is a prolonged usage of steroids.
What are those UTIs?
UTIs. Example of UTIs, we can have a pyelonephritis. So pyelonephritis, that is infections of the kidneys. Okay. We can have the infection of the bladder, which we call infection of the bladder. Then we can also have infection of the urethra, where the urine passes. Now we understand that according to the normal anatomy, we have the kidneys, we have the ureters, we have the bladder, and then the urethra. That is a root of how urine is formed until when it is stored temporarily in the bladder. So in case of anything, for example, the other risk factor is when someone has the urge of urinating, but then they hold the urine. So on holding the urine, someone can get a reflux. Or when that urine stays for long, it means because what we pass out tends to have microorganisms, because they are part of us. But if someone holds it up there, it means they are going to accumulate. Then after accumulating, it means they can colonize, and then they ascend, then they go up, and then they affect the kidneys, they can affect the ureters, or even the bladder where the urine is kept temporarily. And then the other passage where we see it coming out, it's called the urethra. Someone can also get the infection of the urethra, which we call urethritis.
Okay.
Yes.
I get. How can I know that I have this kind of infection?
Now, understanding how someone could be having, let's say, a UTI or an STD. I'm sorry that we are trying to integrate two broad terms all together, but most times they actually present in the same manner. One, someone is going to present with a urethral discharge. That's if he's a man. Someone is going to present with a vaginal discharge. That's if they are, it's a lady. Someone is going to present with pelvic pain. Someone starts to feel pain around their genitalia. Then the other thing, someone can present with a fever.
Okay.
Someone can present with a lower abdominal pain. You understand? Okay. Then when we talk of a UTI, now the picture is even broader. Someone can feel burning sensation. When they're passing urine, they're feeling a burning sensation. Then the other thing, someone has the urgency of wanting to urinate almost many times in a day. Or there's also a tendency of like, I want to go and void, but the bladder is empty.
Okay.
Yes, all these are caused because of the irritations of the microorganisms that are colonizing the urinary tract system.
Oh, like people have always had these signs and symptoms, but at times they think that maybe it is normal. Maybe they see a discharge and they think that maybe this has stayed for long and it is normal. Then what do you tell to especially ladies out there who always observe these signs, these symptoms, but then still they don't make a step? They think that it is normal. What can you tell to these ladies?
Now, to these ladies, we need to tease out. Now, in medicine, when we're trying to integrate things, we always think about what we call the risk factors. Mm-hmm. Risk factors are some of the things that can lead to a problem. One, we need to tease out whether this person is, let's say, sexually active. If, they're sexually active, are they sleeping around with one partner or they have multiple partners? Because it is very important to understand. The only way, the normal way, where we can say someone is passing a discharge, probably that's when someone is about to have their menses. Because there is a mucus discharge that tends to come out from the genitalia of a woman, and that just shows that someone is ready, is about to ovulate, or they are close to their menses. That is very normal. But to someone because that discharge tends to even be foul smelling, it smells badly, that's when you will understand that actually things are not going on well. But the one that is passed before menses or ovulation, it tends to be thick, colorless, and not foul smelling.
So that is a normal discharge? That's
a normal discharge.
Oh.
Yes.
All right, thank you so much. And finally, to our viewers who are watching us, thank you so much. We are humbled to have you, and we know that we are here to teach so that you can learn and unlearn what you knew, and yes, know more about your health and how to keep safe. Today it was all about exploring more about reproductive health. It is a very broad aspect, but we picked out very few aspects so that you can be able to pick something for today's discussion. So doctor, how can I get rid of an infection?
So getting rid of these infections, I want to first separate them, since we have talked about STIs and UTIs. Now, getting rid of STIs, the sexually transmitted infections or diseases. One, someone needs to use barrier methods. Let's say if they cannot abstain from having sexual intercourse, then they need to use things like condoms. Okay. Because a condom is good. It can protect someone from getting sexually transmitted infections or diseases. Yes. For example, the syphilis, the gonorrhea, and trichomoniasis. And then the other thing, if it is possible, someone can avoid to play sex. Can abstain, thank you. And then the other way is also vaccinating, because some sexually transmitted diseases or infections, they are caused by viruses. Let's say HPV. HPV is a human papillomavirus, or hepatitis B. All these things can come as a result of sexual intercourse. So when someone is vaccinated from hepatitis B, because we understand hepatitis B can be transmitted through sweat, through any vaginal or penile discharges, or even blood. Okay. So it is that infectious. So when someone is vaccinated, it prevents them from getting such infections. Then the other thing is HPV, Human Papillomavirus. Actually, this is one of the commonest cause of cervical cancer in sexually active young ladies. So when someone is still vaccinated of this HPV, they cannot get the infections. It reduces on the chances.
At what age am I supposed to get that vaccination?
Sorry, pardon me?
At what age is one supposed to go for that vaccination?
The HPV vaccination should be gotten as early as 12 years.
12 years?
Yes, or even from 9 years.
Wow.
Because that's when ladies tend to be sexually active, as early as 9 years, because they start to ovulate. Okay. And because there's also an association between the hormonal as well as the behavior of someone, leading to the cervical cancer. Then the other preventive measures, in males, it is important that they do circumcision. Circumcision does not prevent someone from getting an STI, but it reduces on the chances. Because during sexual intercourse, there is a tendency of someone getting a tear in process of the thrashing, all the activity of sexual intercourse. So, but if someone is circumcised, it reduces on the chances because the friction is low. You understand?
I understand.
Yes. And then when it comes to UTIs, UTIs are commonly brought about by just someone not having a good hygiene. So one of them is actually having multiple partners.
Okay.
So it shows to us that also having multiple partners, it can predispose someone to getting a UTI. Because imagine you're having a partner who is not hygienically clean, or you're having multiple of them over time. It means problems can arise.
Yes.
Then the other thing, you need to look out. You need to look out on your hygiene. How do you keep your inner clothing?
Okay.
It is important. Are they kept in a dry area, or you just dump them anywhere? Because it is important. And then you should also look out, not for, you should not wash your private parts with soap or detergents. They just disorganize the normal flora or the bacteria that stays with us, or with the female, in the female system. So it is important to be taught or to know how to wash your private parts with just clean water. Unless if you identify any funny foul smell or any funny discharge, that's when you have to consult with your doctor.
Okay. Thank you so much. The doctor told us everything that we would like to know. To the women out there, to the ladies out there, to the girl children out there, I know that we are facing many problems concerning reproductive health, but he was here and he has been here to let you know how to keep yourself healthy. And I think we've talked to health for some good time here, and you have something to learn. As we conclude this, a word to the people out there who are watching.
I would want to thank you all the viewers. Thank you so much for your time. But one word I want to leave with us is that let's be alert. No one is responsible for your health, but you're always the number one culprit in case of anything that would probably go wrong. You're always number one. So let's watch. STIs are real, UTIs are real, but let's be alert. All lives matter. Thank you so much.
Thank you so much for your time. Thank you so much for honoring my invitation to come and, talk to the people out there. And yeah, I personally have learned. So thank you. To our viewers, it has been Bridget in Cementa and a student at MUST. And I am happy to be delivering to you every information that will be able to help you as we grow, as we glow in this country of ours, in life. So mind your health, and as we end the show, I wish you all the best. Thank you so much, and follow us on all AET platforms. We love you.
You're watching AET TV.